I'm going to perform a treatment on the upper knee portion here. So again, make sure you apply adequate amount of gel. I usually put enough gel that covers the whole square that we've blocked off. And that way we only need to apply gel once. We can use that same amount of gel through the whole treatment area. The machine's set, ready to go. Get it out of standby. And in this area, what I like to do is I like to squeeze the leg, the fat, and push as much fat into the area as possible when I'm doing it. I'm going to work in the vertical position, straight down. Then I'm going to work across in the horizontal position. I'm using the 6mm cartridge here. And I'll start at the top of the first quadrant and just start working my way down. Remember, we're going to use 25 shots per box per 1.5 inch square. The markings on the cartridge kind of give you a guide as to how to position the cartridge and use it. The sides of the cartridge show the length of the shot. On each end of the cartridge there's a line that shows you the center of where that shot is. So it may look like I'm going past the first quadrant, but I'm actually not, because if I look at the top and bottom of the cartridge, ends of the cartridge, you'll see the lines match up perfectly with the end of the block that we're working on. Now I've finished that length, now I'll just work my way backwards going up it. So we're basically doing 12 shots, 10, 12 shots down, 10 or 12 shots up, and that way I get adequate coverage of the whole area. And it helps the client feel a little more comfortable because you're not spacing the shots significantly close together. Now we've gone in the vertical direction. I would continue doing all blocks in the vertical direction, and then I'm going to switch to going horizontally across, and I'll show you that right now. So I'll slide the gel back up into this quadrant and position myself to move in the horizontal position across the joint, the knee. And again, I'll try to squeeze a little fat up into the area because we want to get as much fat underneath that cartridge delivery as possible. As you can see, I'm moving across. I'm going to pause it, just check the skin, make sure there's a little enough gel. I'll switch directions with my handle so you can actually see a little bit better. Start right here. You can see that the line of the cartridge, black line, is lining up with the line that designates that side of the quadrant, and then just continue the process horizontally. Doing it this way creates a nice matrix of vertical and horizontal shots that covers the whole treatment area, each quadrant, each square. Again, we're going to do 25 in one direction, 25 in another, each one of the quadrants. If time permits and you want to combine a more fat reduction treatment with some skin tightening, you will start with your fat reduction treatment. It should be ending for the first round, and then go over it again with your shallower cartridge, one of the skin tightening cartridges, to perform the skin tightening process. Generally I'll wait until after the next treatment to do the skin tightening part.